Hi there, I'm Corey McFarlane. I'm one of the anesthesia providers here in Sioux Lookout. And I was talking to a researcher anesthetist in Toronto and received some gifts that I'd like to chat with you about. We were given two firefighter masks, which have a double seal. So there's one for the face, one for the mouth. And there's a 3D printed valve so that we can use this. So this little 3D printed valve fits on here and locks into place and adapts down to the standard size we'd use for all our ventilators. Now the advantage to this mask as opposed to our regular CPAP mask, we have a double seal, and in the time of COVID, if I have two seals around the face and I'm using non-invasive ventilation, there's way less risk, I can't say no risk, but very close to no risk of viral particles leaking out. If this was used in a negative pressure room, there should be minimal risk to staff members of contracting COVID. In the north, without a negative pressure room, this would be a much safer option than our regular CPAP mask as well. We're not quite ready to use this in the north because there is some design changes that are happening. Most notably, the standard securing devices are just these pull tabs. So Sam, if you put that on your head, we'll just show this going on his head. So we got a seal around the chin down here, if you look on the side. And then one around his mouth and nose. And here's how you secure. You pull the tabs back on each side and the top. How is that, Sam?
Not too bad.
And you can hear him. So if you put your mic over by here and just, that feels okay,
everybody.
Sam?
Yeah, this feels fine.
So this is a huge difference from our regular CPAP masks. These are speaking valves, so firefighters can talk to each other. And now in a patient who's got respiratory failure, who's found they're scared and you can't communicate with them, with this device you can communicate with them. The problem we have right now is with these securing devices, there's no quick way of getting this off Sam's face. So if he vomits or if there's some reason we need to get this off his face, we have to, you can get it off quickly, but if we had a quick connect that unclips quickly, that's design number 2 that's just being created now. I don't have any of those masks here in town, but that would make this much safer. If we were trying to prevent intubation in these people and we're going to keep this mask on for days, we would need to feed them. So they might need to sneak an NG tube in the side of the mask somewhere, so there's a small risk of a leak there. Again, that's very minimal by having the double seal. So we have our patient who's in respiratory failure. We don't want any COVID, so we give him a viral filter. That is a standard size, fits right in. We're protected. We could transport him now. We could do whatever we wanted. But he needs some extra oxygen, so we will crank up our oxygen, put our bag valve mask on here, and we can just crank that right up. So our reservoir fills up. So as Sam breathes in, the bag shrinks, and as he exhales, it exhales out the PEEP valve. So the inhale's coming through here, and you can see the valve close as he... So, is that breathing out? No, that's in. That's breathing out. So it closes, and breathe in, it moves away. So he gets 100% FiO2 when he's inhaling. Expiration happens at the PEEP valve, and if he needs more PEEP, we would dial up our PEEP valve. To give a bit more assistance, we have again this auxiliary port here that's for sampling CO2. We've just connected a standard. Do you want to hold this bag valve mask? Perfect. We've just connected a standard extension tubing, and we would put that into the wall to create a bit more flow that is on the other side of the PEEP valve going straight into him. So this one, you can put up to 5 or 6 liters of oxygen, and on the bag valve mask, 15 liters of oxygen. So 20 liters of oxygen total, and we'd use this to temporize someone to try and hold off intubation.
How are you feeling, Sam?
Doing all right.
All right.